Hello. So Hayden,
Hello, everyone.
he is a recipient. I would also like to introduce Audrey. Audrey is a living kidney donor. Lastly, next I would like to introduce Jaquita, whose last name the interpreter is missing.
Johnson.
Anyway, she is from Infinite Legacy. And sorry, I'm spelling this Jaquila. I'm sorry, I'm spelling this wrong.
It's Jacolia.
Oh, that's unique.
So Jaquila is here.
Beautiful.
And then Aisha. Anyway, we will be recording this just to let you all know. So again, you should be able to see the captions on the bottom, or you can see it via stream text. Also, you should be able to see the interpreter. So, any questions prior to us starting? Okay. All right, so thank you so much. So the spotlight should be on the speaker. And if somebody could please remove my spotlight and spotlight the speaker.
And I'll be kicking us off with the first few slides. Are we able to pull up the PowerPoint presentation? Thank you, everyone.
Yes, I can do that.
Thank you. And thanks to everyone for being here tonight to learn more about organ donation.
Sorry, Jacolia, hold on just a sec. This is Debbie speaking. Eileen, I do not have a PowerPoint presentation. I don't know where that went.
If you are able to give me sharing, I could share it.
Absolutely.
Okay.
Let's see, let me do this. And then you should be able to share.
Okay. Can you see my screen?
Yes, we can see that.
Okay, great. All right, so we can go ahead and get started if everyone's ready. So just an overview of some of the topics that we're going to talk about tonight. We're going to talk about why there is a critical need for organ donors. We're also going to tell you a little bit about our nonprofit. Infinite Legacy is the name of our organization. We'll talk about how we get the word out about organ donation and its importance, ways that you can get involved in our life-saving cause. We're going to talk about the Decision Project, which is a grassroots initiative we have to help us. And then the part that everyone came tonight for is to hear Hayden and Audrey's incredible story and testimony about their donation. And then we want to answer your questions. We know that organ donation is a topic that has a lot of, a lot of questions, and we want to answer those for you. All right, so to discuss the critical need for organ donors, currently there are 100,000 people, more than 100,000 people in our country waiting for a life-saving transplant, and 4,000 of those people live here locally. Every 8 minutes, another person is added to the National Transplant Waiting List, and sadly, 16 people will die every single day because the organ they need is just not donated in time. So this is a public health crisis, and we appreciate you all being here to learn more. So you might be wondering what organs can be transplanted, and one organ donor can, well, actually, I don't want to give that away. So that's later in the presentation. You can donate your heart, your lungs, both of your kidneys, your liver, pancreas, and intestines. And then also there are tissue donors, and they are able to heal as well as save lives. Tissue donors can donate their cornea to restore sight to 2 people. so that they can see again. They donate heart valves. A lot of times pediatric patients will need a heart valve replacement, and that comes from a deceased tissue donor. Also skin, a lot of times if someone's in a fire or has traumatic burns, skin can help. And then bones, tendons, veins are all ways that you can save lives as a tissue donor. And now I'm going to turn it over to Aisha for the impact an organ donor can make.
Good evening, everyone. And as Chicolia mentioned, and with tissue donation, I myself am actually a tissue recipient. I am a tissue recipient of donor bone. So one organ donor can save 8 lives. And as Chicolia mentioned before, that happens when someone donates a kidney, a lung, heart, small intestines, pancreas, and also our tissue donors can save can restore sight to 2 people and heal and enhance over 75 lives like mine. About Infinite Legacy, so we are one of many organ procurement organizations across the country. We service Northern Virginia, Washington, D.C., and all of Maryland. We work with 68 hospitals and over 8 transplant centers here in DC, Washington, Northern Virginia. And the reason why I said more than 8, because there's a new transplant center opening in the upcoming year. And what we do here at Infinite Legacy, although there are over 100,000 people waiting for a life-saving transplant, we actually work very closely with our donor families. These are the families and the individuals that gave the greatest gift that they could give someone, and that is life. And this is a story of one of our amazing volunteers, Sierra. She's holding a picture of her daughter, Sienna, who was a tissue, cornea, and heart valve donor. These are the reasons why we get up to do what we do every day, because we want to honor those that say yes and support them through their times of need. And what part of things that you can do to get involved with Infinite Legacy, my department, which is community outreach. We work very closely with Jacolia's department, which is communications and marketing. We can't have one without the other. We do a lot of events in the communities, such like this. We work with our MVAs, our DMVs. We work with churches, we work with high schools, middle schools, and any community organization that would have us. We do a lot of presentations throughout our service area, and we do a lot of our messaging through media. We do a lot of our messaging through media, which is earned and grassroots media. A lot of our community residents hear about what we do from media, and so we love to share stories and love to share the power of organ donations, such as Hayden's and Audrey's. And then social media, we're all over social media. We have a Facebook, a LinkedIn, an Instagram, a TikTok, and I believe that is it. I know there's more to come with the way the world is moving when it comes to social media, but you can find us anywhere, and we're very attentive. We have 100% reply rate back on our social media campaigns.
Thank you, Aisha. So to talk a little bit about how we get the word out through the media, we do work with local news reporters to tell some of these very heartwarming stories. And so this is just an example of some recent media coverage that we got. I know we're all here tonight, so we aren't watching the 6 o'clock news right now, but we had a huge story today. It's very sad. You might have heard about the 2 brothers from Clifton who died in a house fire. They both became organ donors today. And so we were able to honor their gift as heroes. They were 6 years old and 3 years old. Again, this is a huge tragedy for their family. But their parents, in their grief and in their shock, made the brave decision to say yes to organ donation. And because of that, these two boys together as brothers are going to save up to 9 lives. And so we were there today at Children's Hospital. It was a very emotional day. And the media was there, and they're going to get the story out on the news tonight about how these boys, they were named William and Zachariah, are heroes. Okay. Another way that we get the word out about our cause is through advertising. We are a nonprofit. We do have a limited advertising budget. And so we're doing campaigns with NBC. This is a campaign right now featuring 2 people waiting for an organ transplant. They're desperately waiting for their phone to ring and get that call that an organ was donated in time. John on the left hand of the screen is waiting for a kidney, and Sheila on the right hand of the screen, all the way to the right in the top, is waiting for a heart transplant. Sierra on the bottom left and Monica on the bottom left in the advertisement that says, "Imagine if the bus never comes, next stop hope.org." These ladies are both waiting for a kidney transplant. So we're doing what we can to get the word out and get it out in an authentic, meaningful, creative way, to kind of cut through some of the clutter and make sure people hear our life-saving message. And now back to Aisha.
A lot of the education that we do with our community is to dispel a lot of myths and misconceptions about organ, eye, and tissue donation. And a lot of things that we hear in the community day in and day out are things such as rich people are the first to get an organ. Well, we may hear a lot about celebrities or famous people getting a transplant, and that is because, number one, they're famous. We're never really going to hear those stories that save lives, such as Sierra, who was posted earlier tonight, or Olivia, who's from Montgomery County, who got her transplant when she was a little girl, or Hayden receiving his transplant. We're never going to hear about that on a national level all the time. So we will hear about those major celebrities first, but that does not mean that they're the first getting a transplant. It's just because of the notoriety it brings. And so what Jacolia and I do and our teams, we want to put our local stories out so we can share them locally and even on a national level so everyone can understand real people do get that second chance. We hear a lot about organ donation is against my religion. A lot of our major religions actually support organ, eye, and tissue donation. They see it being one of the last acts that someone can give. When we do hear things like that in the community, we never tell someone, well, actually, no, Catholics do donate. We always say, please talk to your faith leader and have a conversation, because a lot of people do rely on their faith leaders for guidance. But again, we do have quotes and information from major faiths that support donation that we will share with the community if they would like it. So we do make sure we have brochures to talk just about that. Other things that you may hear in the community is that my family will have to pay for organ donation. They actually don't. Organ donation is paid through the government, such as Medicare and Medicaid, the recipient's insurance, and then also funding that comes from the transplant centers. And then one of the myths that I would like to talk about tonight is something that we hear, number one, across all walks of life, is that if someone knew I was an organ donor, they would not take care of me and would not save my life because they would like to take my organs. Doctors and nurses, for their oath is to take care of patients. Infinite Legacy are the only ones that can know if you're an organ donor. That is HIPAA information that's confidential, and the hospital team has no idea if you're an organ donor or not. We're only called after the hospital and the physicians have done everything they could do to save your life, and the next end of life option could be organ, eye, or tissue donation. Next slide, Jacolia. Thank you. And how can you register to be an organ, eye, or tissue donation? You can sign up various ways. You can sign up at your local DMV, or if you're in the state of Maryland, at the MVA. Online is an easy way to become an organ, eye, and tissue register to be an organ donor, because you actually can share that decision immediately with your friends and family via the system. At any of our community events, we have signs with QR codes that take you directly to the registry. And if you have an iPhone, there's actually an option under the health app that you can sign up to be an organ, eye, or tissue donor. Or you can visit our website at www.infinitelegacy.org, and you can also register there. Sharing your decision is one of the most important things that we want to emphasize tonight. A lot of times people, when they're in that end of life discussion, and when we're talking about organ donation, the family member may say no because they never had that conversation and they do not want to make a decision of their loved one. So whether you sign up to be a donor, whether you need to have more, to talk more with your family about it, we want you to share that decision, because if something were to happen, your loved one will feel so good to know, yes, Aisha made that decision. I know she would like to do this. So that's how we kind of have those conversations with our family, is to share those decisions. And here are a few examples about how you can bring this up. If you go back, talk to your family and friends after this presentation tonight, and you say, oh, I learned about donation. And they were like, well, what did you learn? And you can just say, well, these are the things that you want to say to them if they bring up a myth or misconception. So after watching a movie where it was a tragic accident or illness or death occur, and in that movie, they bring up donation, and it may seem fast paced, like Grey's Anatomy or ER, where the transplant center and the patient is right next door, and 2 hours later, that transplant happened. It doesn't happen that quickly. So you can always just say that the hospital and the organ procurement organization are two different entities, and that the hospital is there to do everything they can do, and they're going to talk to that local organization like Infinite Legacy to make sure there's a possible way to be an organ donor. We do a lot of discussions with our community and teams at events, sometimes at family dinners, and it does come up because you can be talking to someone and they can say, well, I don't know, I heard that if I register to be an organ donor, they're gonna take my organs right away. And you can actually explain, no, the hospital is there to do this job, and your the organ donation organization is here to provide options if that time comes. And we always want to emphasize that one donor can save up to 8 lives, and there are many ways to be a donor. You can also be a living donor and donate part of your kidney to someone or part of your liver to someone else, because the liver is the only organ that we have that will regenerate itself. So donation, there's so many amazing stories, even through that grief and loss of someone else. So some of the events that we do in our community, these are our amazing Donate Life ambassadors. Our Donate Life ambassadors make up transplant recipients, donor families, or people who just have a connection to donations, like some of our hospital partners and some of the nurses and doctors that we work with. We have various ways to be involved. You can volunteer, and sometimes volunteering means coming into our office and doing fun admin work and stuffing bags and putting kits together for the homeless that we work with. So it's not always a speaking opportunity. It's not always a tabling opportunity. There's so many ways to give back. If there's an event happening in your community and you think Infinite Legacy should be at and host a table, please contact us. We love to be anywhere and everywhere. And our volunteers love being at events, sharing their stories. And as we mentioned earlier, following our social media, reposting, sharing, tagging. That is another way to spread our word. And we do a lot of fun contests sometimes on our social media platforms as well. And something that I want to talk to everyone tonight that is very true to my heart is our grassroots campaign that we do with our communities that are living in areas that are marginalized or underserved communities. And that is from rural communities, cities that have a high crime, cities that are in a food, have food deserts, food insecurities, or lack of access to healthcare. We want to make sure that they know who Infinite Legacy is while they're still living, and that we were doing things to support them in their time of need and not when we're coming to them at the bedside, asking them to be an organ, asking their loved ones if they would like them to be an organ donor. So I would talk just a few little things that we've done with the Decision Project. We sponsored teenagers to go to camps in the summer to provide them different opportunities and what they would see if they were just in their local neighborhoods. We have grants with the Maryland Food Bank and the DC Capital Area Food Bank to provide food to families that are in need. We host our own neighborhood block parties in their neighborhood so they don't have to worry about transportation to get screenings for blood pressure, for transplant screenings, for HIV, for things with healthy babies, and then we give them clothing, food, and just a good time for them to have access to vendors and community organizations that they may normally not be able to have. So that's what the Decision Project is about empowering our communities and remembering them when they're here and having them share their decision with their loved ones.
Thanks, Aisha. So we just wanted to give you a little idea of the impact that our organ donors and our eye and tissue donors have made locally. So last year in 2023, 737 lives were saved locally. So these are local statistics, Northern Virginia, where most of you are probably joining us from, DC and the state of Maryland. So 737 lives was 839 organ transplants. These are from deceased donors. We also do assist with some living kidney donation recoveries, but this is just the deceased donor numbers. So that was 284 organ donors that we had in our population that serves almost 10 million people. There was, over 1,200 eye and tissue donors and 754 donors in spirit. If you're wondering what a donor in spirit is, it's someone who's intended to be an organ, eye, or tissue donor, but medically there was a determination that they weren't able to be a donor. But their intention was there. Their heart was in the right place, if you will. And so we honor them and provide support to their families as well. And, I won't read all of the numbers, but in general, there were almost 5,000 lives saved or healed thanks to our Infinite Legacy donors in 2023. So big impact there. Sorry, I just realized I didn't have my video on, or I shut it off. Okay, so this is going to probably be the best part of the evening. Wanted to introduce Hayden and Audrey to share their story. I don't know who's going first. Hayden, I don't know if you're going to go first, probably, but just take some time to really tell us about your story, and I'll let you guys take it from here.
Hey, this is Hayden. Could you turn the slides
Yes.
off so that they can see me? Yeah, just turn off, stop sharing.
Yeah, I just want to make sure everybody can see me signing.
Did that do it? Here, let me stop share. There we go.
Hello, everyone. How are you all doing today? My name is Hayden, and the interpreter needs to repeat your last name again. I'm
Shook.
sorry.
Hayden Shook.
Shook. Thank you so much. And I'm having a problem there. I need to close the captions because you're located in a poor place on my screen. I just need to.
Do you want me to take over, Susan?
Yes, please go ahead so I can fix this. Thank you.
All right, great. So I just want to tell you my story. So about 12 years ago, my mom, she actually donated her kidney to her brother. So, and my mother asked me, do you mind if I would escort her into the hospital while she donated her kidney? So I remember while she was in the hospital, the two of us had this bedside chat. My mom had said, you know what? I hope none of my kids ever need a kidney. So little did we know that a few years later, I would need one. So I got kidney disease. I started in about 2016 suddenly. So it was my senior year in college. Luckily, I was able to graduate on time, but I didn't start my dialysis for, I don't know, it was a little while later. So anyway, I was on treatment for almost 11 months. And during that time, wow, was it tough. I mean, I was very blessed to have just a lot of people who are willing to be tested to see if they were a good match for me. I did have several matches, but unfortunately, I did have other health issues, health complications, so that precluded me from getting a transplant from, or those other people had their own health issues and they couldn't give a transplant. So that pushed my transplant day back. So then I heard from this person, her name is Audrey. She's my angel. And she just turned my life around. So it's been almost 7 years now. I've been healthy for 7 years, and a lot of things have happened in that time. As soon as I got my transplant, I woke up and I felt like I had never felt better. I just had so much energy. I just felt like a completely new person. I mean, just wow. And then 3 months later, I actually moved to Boston, Massachusetts, for my graduate school. And I mean, I just tell you what, it just was like the best year of my life. I lived it up. I mean, I just felt like I missed a year of my life because I'd been sick. So, and then someone gave me the gift of life, and then just going into Boston, that was just the best that could happen. So I continue every year just feeling better and better and better. I'm so blessed with good health. It's been 7 years now later. I'm married. I have a wonderful job. I got my second graduate degree. I just feel so amazingly blessed to even be here today. So huge thanks out to Audrey. I love you, Audrey.
I love that Hayden always talks about how when he wakes up in the hospital and he feels so amazing. I woke up in the hospital, felt like I got hit by a truck, but that is all in the past. So hi, everyone. I'm Audrey Hardwick. I am Hayden's living kidney donor. Even though it's only been almost 7 years since surgery, my story also starts over a decade ago. I met Hayden briefly when I worked at his high school. I never taught Hayden, but I knew who he was, and I'd always heard these amazing things from the people who worked with him in the high school. Years later, Hayden's a senior in college, and I overheard that he was looking for a kidney donor. My friend and Hayden's former sign language interpreter saw a social media post from Hayden's mom. Now, neither of us had any knowledge of all these things that were going on with Hayden and his health prior to this post. Hayden's mom was reaching out on social media to anyone and everyone for potential donors, and it was truly without hesitation that I asked for the contact information. When I think about that day, my response to hearing this post was a little anticlimactic. I remember listening to my friend read the post, and my immediate reaction was to shrug and say, "I'll do it." That was really it. It wasn't a flippant decision, but it was an immediate one. I don't know exactly how to describe it. I've had years to figure out how I've come to this decision, and I still don't quite understand how immediate that decision was in my mind. But I saw this young man truly ready to start this next chapter in his adult life, and I saw all of that being quickly taken away from him, and I just wanted to do something. So it wasn't until December in 2016 when I finally got a call from the transplant team. They were ready to review my file, begin the process to become a donor. Unfortunately, just the way it works, they have to do one donor application at a time. So it was, Hayden was biding his time waiting for all of these donors to be processed. And I know he had mentioned that he had difficulty finding one. There were several individuals who applied and then didn't make it for one reason or another. And I don't mean to make this decision seem like a simple one, but for me, it was pretty easy. Throughout this entire process of testing and consultations, I was still confident in my decision. And there was some part of me that just knew every step of the way it was going to happen. So it's been almost 7 years. I have no regrets. The procedure itself has had no real significant impact on my health or my life choices. It's kind of funny to me when I first met with the surgeon, he had to go through all this paperwork for the informed consent. And he said that the surgery is considered 100% risk to the donor, since there's no medical necessity on my side to actually have the surgery performed. I didn't say it at the time, especially not to the surgeon, but I absolutely disagreed with him. It's been almost 7 years, and I've only ever considered this to be 100% benefit to me, even if we couldn't put that on paper medically. So before we started the presentation tonight, the term hero was thrown out. I've always joked that Hayden and his family are the only ones who are allowed to call me that. I don't consider what I did to be heroic. When I discuss my donation, whether it's privately with a friend or publicly on a platform like this, my goal is to normalize a decision like this. I'm hopeful that's what we can achieve tonight, and I really appreciate you all taking the time out of your evening to hear our story.
Love you. Thank you.
And I think at this time, we could probably take questions from everybody here on the Zoom, whether you have questions for Hayden or Audrey, or a question for us at Infinite Legacy. And I don't know if there's a specific process of maybe putting the question in the chat.
That may be the easiest.
Let's do that. Does an employer have to provide paid time off for a donor? So that is a great question. In our organization, Infinite Legacy, we work specifically with deceased donors. So we're not as, I'm not an expert on living donation, but Aisha, I believe that there was legislation, at least in Maryland, where employers do give time off for living donation. Are you aware?
Yes, that is correct. Oh, had my double security screen on. Yes, that is correct. I believe with the state of Maryland, it's a $7,000 tax credit back to the living donor. I think it would have to be per your employer's policy on probably short-term disability. And Audrey raised her hand from someone who's been through it herself.
Yeah, so I didn't share this before, but I'm a teacher, so I'm working specifically with my district in Virginia with this. We actually thought that we were going to have the surgery during the school year, so I was looking into short-term disability. It is something that is covered, but it's going to be something that's very specific to your employer, but it does fall under that category.
Thank you so much. And then there was a question about whose insurance covers the procedure. Was that a question about living donation? Do we know?
If it's deceased donation, it will be the transplant recipient's insurance.
Okay, so we'll just go. Thanks, Aisha. Someone, Marianne would like to say, oh, real quick, can a person who's a cancer survivor donate organs after going through chemo and radiation? So what we always say is register to be an organ donor. And at the time of your death, like doctors will make the best decision medically and they'll make a determination. So it is not a deferral for all cancer patients or survivors. It really is a case-by-case basis. And so I always encourage people to register to be an organ donor because with technology, it's rapidly changing and science and medicine. And so someone who might not be able to be an organ donor today might be able to be next year. And so just don't rule yourself out. People tell us I'm too old, or you wouldn't want my organs. I eat too many potato chips. I don't lead a healthy lifestyle. We always just say, don't rule yourself out. Everyone can register to be an organ donor and make a huge impact regardless of your medical history. And then, oh, it's Hayden's mom who wants to say a few words. Well, yes, let's give her the floor.
You're muted, Marianne.
Okay, can you hear me?
Yes, thank you.
Okay, so just as my story real short is my baby brother said, hey, I need, it's going to be time for me to go on dialysis. I need a kidney. I felt exactly like Audrey. It was a no-brainer. I was a mother with 6 young children at home, teenagers and younger. And I kept telling my husband, I have to do this until I test out. I just have to do it. And I was the only donor. I was a 6 out of 6 match. But what I wanted to share is I did everything here in Northern Virginia. All my labs, all my tests, all my everything was handled here. I did not fly to the University of Texas Transplant Center until 2 days before donating and meeting that team, which I wanted people to kind of know that after looking over our record, it's been 12 years since I donated. It turns out that the Inova Transplant Center here was working very close with the transplant center in Texas. And Dr. Wally, who happened to do Hayden's transplant, was my doctor also. So it is a very small world how this turned out. When Audrey came up, we knew as a teacher that there would have to be some fundraising to help offset, because you cannot buy a kidney, you cannot earn 1 penny donating a kidney. And so we did all of our homework. And we had Audrey lay out every expense that she would have while she would be recovering from this donation. And we were able to set up a GoFundMe page. And again, through social media, blasted it out. And once we reached that exact penny, the site shut down and Audrey was never out anything. So I know Audrey doesn't, she allows us to call her a hero, but I never got to see my brother sick. I never got to see him on dialysis. I never got to see anything. I donated the kidney, I stayed a week, and I came back home. And so I too recovered nicely, but I never saw my brother sick, and I kind of never really saw him healthy. He is healthy and he's doing fantastic. But Hayden, I did see sick. I did see my baby boy crashing and white and yellow and puffy and all kinds of medical things that were coming down. The ambulance would have to take him from dialysis to the hospital because he had crashed. If it wasn't for his health and his age prior to this, it could have not been a good situation for him. So when I saw Hayden come out into recovery, he is not kidding you when he said he had color and he looked at me and he said, I am back, Mom. I am back. I feel fantastic. And he just powered through. So anyway, thank you, Audrey. You are a hero. I love you. And I love everything that you guys are doing here. It's fantastic. I wish I didn't have to age out. I think I'm healthier than some young people because I try to keep giving part of my liver and nobody wants it. But my husband and I actually do date nights to donate blood every 6 weeks faithfully. So Inova Blood Center just laughs at us because we race how fast we can fill up our bags. But give life. It's amazing. Donate. And thank you, everybody, for this time.
That's amazing. So we have two
Love you, Mom.
living donors on the call. Anyone else want to step up? Is there any other living donors here on the call? Oh, great. Aisha's responding to some questions in the chat. Yeah, and then living donation. So would
Hi,
someone,
everybody. Yes. My mother, before she passed away, she did donate her body to students for study to university. And so when she passed, she was transferred and there was a memorial placed in her honor for people. Yeah, you just shrunk all of a sudden. Yeah, no, you're good. You said there was a memorial in her honor when you're. Mhm. So my mother donated her body to a university for study. And then the question was what to do with the organs from that. And so they sent it 45 minutes to there was a cemetery that they have a honors for a burial place for people who have done donations. And then later, this was during when COVID hit. So we couldn't go there and see the presentation. And they had slides with captions that they had and interpreters. And it showed pictures of the people who had done donations of donating their bodies to science here in Virginia. And I'm not sure what Maryland and DC do when a person donates their body. Suppose that I'm not doing well and I decide when I pass, I want to give my whole body to science for study. I'm not sure if they toss it in the trash or what they do with us once they're done. I don't know if anyone else knows.
yeah, so I personally, we don't deal in whole body donation or donation for science, but you can be an organ, eye, and tissue donor and donate for science. How that would work is they would recover the organs and eyes and tissues that can be used to save lives first. And then they would work with the agency that you donate for science. As my understanding is that in many cases, the whole body programs will return the body to the family. But I'm just not an expert on that. I am going to drop a link in the chat, though, of a great organization for whole body donation that is local. I hope that helps. And I think there was a question for Audrey. How is your recovery immediately
I
after?
hope it helps too. That would be nice to know. I think it would be, I just hate the thought of someone being put in the trash. I just don't want to think of that.
I will drop that link in the chat. And there was a question for Audrey about how is your recovery immediately after surgery?
So immediately after, I was in the hospital for, I can't remember, a couple of days, I want to say. The surgery was entirely laparoscopic, so there was a faster recovery time with that. I would say the biggest impact was abdomen pain just from the surgical sites, and then limited energy. Those are the two things that I remember the most, where I would go for short walks outside and I would need to come back and take a break. But I would say after 2 weeks, I have a photo I wish I had maybe loaded to share. It's just a cute photo where I'm actually hiking 4 weeks after surgery, able to go on pretty typical hikes that I would have gone on prior. But the longest piece for me would have been just typical abdomen pain from a surgical site. But otherwise, that was pretty much it. After 4 weeks, I felt pretty much back to normal.
Yeah, I've heard of people like doing 10Ks after being a living donor. So a similar experience. I am going to drop this resource in the chat. I have right here. This is the great nonprofit. Any other questions? Aisha, did you want to address any of the chat conversation?
Infinite Legacy's website has a wealth of knowledge and resources that you are able to visit. We have some videos, we have links to other partners like the National Kidney Foundation. We also link to our transplant centers that deal with living donation, but you are free to email us via our website and we answer right away, but we're here to help you with your questions. And if we don't know the answer, we will find the answer and get it to you.
Thanks, IJ. Any other questions? We've got a couple more minutes. Not that we won't give people the rest of their evening back. Oh, thank you for the comment, Lewis. Yep. We just, a lot of times with our organ donors, it is an unexpected death. So maybe it is a traumatic event and they're rushed to the hospital and the family might rush to the hospital and not be able to access that paperwork. And so that's why we do encourage, the will is fine, advance directive is fine, but we do encourage you to also register online or at the DMV if you are so inclined. You want to take the transplant game question?
I
all smile.
I'm going this year. I've been to one and it's the most amazing experience ever. But the Transplant Games is put on by the Transplant Games Foundation. They are called the Transplant Games of America. They are every 2 years. This year, it will be July 3rd through July 10th in Birmingham, Alabama. And then we also have the World Transplant Games. So the top performers get to go overseas and participate. But they are a group of recipients, donor families, friends of donor families. We participate in various games, basketball, bowling, ballroom, tennis, track, swimming. And I think there are a few more. I think I'm playing badminton this year, but it's a way for our transplant recipients to compete and do all the things that they thought they may never will be able to do if they didn't get that transplant. But the biggest, my favorite part of the games is the opening ceremony. It is just like the Olympics. You have all of the transplant teams from across the country. So there's Team Maryland, there's Team Virginia, Team California, Team Kentucky, and they walk in with their flags and go across the stadiums. And it's the most heartwarming experience that you ever can see, to see all these people here because someone said yes. And I'm going this year, so I'm excited. Haven't been since 2014.
Hayden is on the USA team.
Looking forward to meeting you.
Oh my goodness. That's awesome.
Can't wait.
I will find you. I will find you. I will be with Team Maryland and Team Virginia. I'm getting t-shirts this year.
And I'm going to find you too, Aisha.
Okay.
Dr. McCartan, is there anything you want to say to close us this evening? We just, I dropped my email and Aisha's email in the chat. We'd love to answer any questions you have. If you know of any events that Aisha's team could come out to in the community, we'd love to hear about them. And we really
Can you see me okay?
All right, so I'm at 5. I need to see. Okay. Uh-oh. Still echo. Still echo. Is your mic on?
I just muted that mic, so go ahead.
Okay, so thank you so much, Audrey and Hayden. Audrey, for your support of this program, and Hayden, it's wonderful. It's so wonderful to hear both of your stories. So I really think this is life-changing. I mean, wow. So we will have this saved on the internet, and I'm hopeful that you all enjoyed this presentation. And I really appreciate all of your time. And I hope that Hayden, I hope you win your big match. And here's your tournament. I think that's really cool. So any final comments?
I see that there was a question for Audrey in the chat from Ruth that I missed somehow. I apologize for that. So the question, I believe, Audrey, you saw was, were there any, did you have to watch what you consumed, and did you have to take better care of your body more than normal after donating the kidney?
Yeah, so I was going to type that, but I can also speak to it. So there was no requirement, like there's no special diet before or after surgery. There is a misconception that you have to go on kind of like a special kidney or like a dialysis diet as a donor, which is not true. The same typical advice would apply to taking care of 2 kidneys versus 1, is that typical healthy diet and appropriate amount of exercise. There is one caveat with certain medications. So it is not recommended, if at all possible, I should not be taking NSAIDs, so ibuprofen or anything that would be filtered primarily through my remaining kidney. It's not because my kidney cannot handle those medications, but if there is an alternative that will reduce any undue stress on my single kidney, then I should take that if possible. So if there's an emergency situation and there's only one medication, then I can still take it. But just day-to-day life, or if I have a headache or something like that, then I should avoid certain medication that is filtered primarily through my kidney. But that is truly the only lifestyle change I have had to make, which at this point doesn't even seem like a significant change to go from taking, you know, Advil to Tylenol. But that's really the only difference.
This is Eileen speaking. So any further questions? Any further questions? Okay. So I can't see all of the chat, but I think we're good. So looks like that. Looks like we're good. So again, thank you so much to our presenters. And again, I apologize if there anyone had with my connection issues on my end, but it seems like it all ran very well. Okay. So thank you. Please enjoy the rest of your evening. Bye, everyone. Bye. Bye. Thank you. Bye. Oh, and thank you to the interpreters and the captioner. Really appreciate your talents tonight.